effects of using a condom? Do you want to know the side effects of using the pills? Do you want to know the side effects of using the morning after pill? Do you want to know the side effects of using any kind of family planning method that you're using? They're here to give you information about the side effects and the use and the effectiveness. Mariestopes is also providing cervical cancer screening. I don't know if the ladies in the building have tested for cervical cancer. The ladies in the building doing have tested for cervical cancer. Yes, the ladies in the building, please don't hesitate to reach out to Mariestopes. They're providing cervical cancer screening. You need to know the risk. The risk rate. How much at risk are you to get cervical cancer? Because this is a monster that is eating up the ladies and causing a lot of problems. Yes, Mariestopes is also providing services like pregnancy counseling, and if you want to stop the family planning method, how do you stop it, and how do you transition from using a family planning method and now maybe if you want to get pregnant and get that kind of service. The Uganda Blood Transfusion Services, Mbarara region, the blood bank, they're here with us. I mentioned before that if you want to save a life, reach out to them and donate blood and save a life. Yes. Also, the AIDS Support Organization is giving HIV screening, TB screening, syphilis testing, counseling, and they also have a gentleman that is from the AIDS Support Organization that is going to give information about where do you go, or how safe is it, and what comes with circumcision. So if you want information about circumcision, reach out to the gentleman in the tassel shirts. They'll give you that information and they'll guide you where you need to go. Yes, thank you so much.
In Kahima Ponjirwe, I'm the Deputy Dean of Students, and I take this honor to welcome you to Mbarara University of Science and Technology. I particularly want to welcome the team from the Ministry of Health. Thank you for choosing MUST to come and offer this much needed service. The team from TASO, you're very welcome. Mariestopes, Mbarara Regional Referral Hospital, the Blood Bank, and Own Your Future. Did I get it right? Yes. And of course, I want to thank the Guild. Thank you so much. This one, I will say it without fear or favor. I think you've been the best Guild we've worked with. You've done a lot of work. You've been busy amidst limited resources, but you've worked hard. You've brought in partnerships, and we are moving very well. And as a university, and particularly the Office of the Dean of Students, these are activities we are involved in. These are things we do. As I speak, we have an activity on gender with some of your colleagues and your lecturers and other staff. So these are all the things as a university that we are engaged in, and we welcome useful partnerships. So those of you who have agreed to partner with this event, we really applaud you and we thank you so much. We cannot take your being here for granted. The other day I was listening into the Director General of the Uganda AIDS Commission, and I took time to jot something. That's why I'm holding this phone. Usually it's not my habit to have a phone, but I took notes. And from what you were saying, it is quite worrying that HIV prevalence has shot up, especially among adolescents between the ages of 15 to 24. So 15, that means my son or daughter who is in S1, S2, S3 is not safe. Yes, they will easily get HIV, and that's very worrying. A few years back, when we started getting people who were born with HIV in these public institutions, because of health, new researches, ARVs, people are living longer and they are living healthier lives. You wouldn't know, you wouldn't tell the difference between somebody who has HIV and somebody who doesn't have, because we all look alike. So it's very, very challenging to protect yourself if you're not so keen on protection. It's easy to be infected. And now imagine we are getting younger people getting HIV and they were not born with it. Okay, so it's a cause for concern. And he also talked about that we've moved from stigmatizing people living with HIV to stigmatizing the responses to HIV. And I said, how shall we overcome that? How shall we embrace the responses? And he also said that there are probably some inequalities in promoting safe behavior. Right now we are discussing equality and equity. So how are these services accessible? Are they easily accessible to all of us? And if they are, how friendly are they? I liked the sign of Mbarara University, Mbarara Regional Referral Hospital, the Adolescent Health Clinic. How accessible? Yes, the service is there, but are we going there for that service as students of Mbarara University? Because those services are for you. Are we accessing them? If we are, how friendly are those services? It's you to judge, to know that I can go there and I can go back for the same services because the service is good. And he also said there's a knowledge and awareness gap. HIV has been here since the 1980s. All of you were not yet born, most of you. For me, I was very there. When HIV came, when I went to Makerere as a young student from a school way far away from the city to the city, the very first day I dropped in my hall of residence, a student had died of HIV. And almost every term, that time we were still in the term system, somebody would die from HIV. I was a young student at Makerere when Fire Rutaya, the famous musician, declared that he had HIV. Even when he came to Makerere to address us, I was there in that congregation. So it was a time of fear, a time of tension, because you wouldn't know. You'd be there, and then the next term, somebody you've been seeing, walking with, and they tell you he didn't come back because he died of AIDS, he died of HIV. So that time, it was tough. And later, I also worked with TASO, and the same thing. You'd go see a client, find them at home. The following month, you plan to go back and you find a fresh grave. So people were dying, but now we are not dying of HIV. We are living longer. People are living longer, but still we are not protecting ourselves enough. So instead of the prevalence going down, instead it's going higher. So where did we go wrong as a society, as Ugandans? Because Uganda was on top of fighting this HIV pandemic. But now, with the rates going up, we shall start fearing you. And that shouldn't be the case because we don't know. Are you safe? Jonathan here was asking, when did you last take your HIV test? And when you took the HIV test, it shouldn't end there. What are you doing to make sure that you don't get HIV, that you protect yourself? If you're HIV positive, what are you doing to take care of yourself and prevent infecting others? Because that's important. We shouldn't be selfish people to infect others when we know about our status, because that's important, that's key. So we really need to increase our knowledge. We need to, the ABC strategy, it worked well, very well the other time, but now there are more strategies. It goes beyond ABC. You know, there's AB, abstain, be faithful, use a condom, know your status, elimination of mother-to-child transmission. There are so many strategies. So how are we using all those strategies? How are we using, he talked of new concepts. If I was here, maybe I would ask the experts from the Ministry of Health to educate me. Pre-exposure prophylaxis, post-exposure prophylaxis. We need to understand all these things so that we protect ourselves, and as we protect ourselves, we are also protecting others. So I once again welcome you and encourage the rest of the students to come and access these services. Be informed, and above all, take care. I would love to see you all graduating healthy and ready to serve the nation. I wish you God's blessing and a nice time here.
Each one of you is going to use 5 minutes to respond to the questions that are available for you. And in case there is a question that is directed to you, we shall give you some more minutes at the end of this panel to respond to that. Okay? Are we good to go, people? Especially if it comes to SRHR and maybe GBV and HIV and all that. Yeah? Especially, guys, I don't know if you're listening, but I want to pick your minds on what happens if you wake up in the morning and then you go and do an HIV test and they tell you you're positive. When you join campus with a negative status, but now you're testing for HIV and they're telling you that you're HIV positive. Anyone, what would you do? Just imagine. What would you do? You know, you joined university with a negative status, yeah? And then let's say Mariestopes is here, and then Ministry of Health, and then they are testing for HIV, and then they call you and they're like, you know, when you're going to test for HIV, there are those questions that these counselors usually tell you. What if you are plus? What if you are? What do you do in that circumstance? Yeah? I see everyone is scared, and that is why I was asking that question. Yeah. So guys, I want to start with your University Minister of Health. Yeah, because we understand people put you in power. You were just appointed, right? Yeah, I know ministers are just appointed. So you're in that office to make sure that your fellow students here in the university access services. Among those services are, you know, SRHR services. And all that, yeah. So we want to understand from your point of view as the Minister of Health from Mbarara University, what are some of the issues that young people, especially those that you serve here, face, especially at campuses today? Of course, issues relating to sexual reproductive health.
Thank you so much. Our students here, as Mbarara University, we have an enrollment of above 500 students, both campuses, town campus and Chumio campus. And we only have 2 university clinics, which operate for a maximum of, I think, 12 hours a day. So we normally face challenges with treatment of sexual transmitted infections, and we also face challenges concerning with access to some knowledge. We have a knowledge gap between the use of contraceptives, which one do you use, condom use, condom distributions in our different areas of residence. We try to bring in some when we have functions, like we had the health week, we distributed
I'm sorry to interrupt. So you guys, I hope you're listening to your health minister. He is saying that there is a gap, especially in accessing condoms, and usually they bring them in when there is a service. So is it true? You guys don't have condoms? Okay, please continue.
So when we have different services, we normally provide a tip of these health services that we are supposed to be providing. Even like today, we are going to enjoy, since the experts are here. We normally have health weeks. We do outreaches, so we combine. But due to our number, the population, there is still a small gap. Then still, we normally find challenges with sex education. I don't know how I can term it better, because most of us are from the .com era. Our parents didn't teach us how to do those things well. In UC, you said people are abstaining, which I don't think it is true. And being this age of sexually active population, most of our people are around 18 to maximum 28. So those people are very active, and the speed of blood and the hormones is very high. So those guys are somehow active. So we need, if we can access some services where we can train what to do at what time and when, it will be somehow fair.
Okay, so I pick up very question, yeah. So I think at this very point you'll help me pass the mic to the representative from Ministry of Health, since they are the decision makers and policy makers, yeah. We all in schools, yeah. So I want to pick up from you, dear Dr. Alan from Ministry of Health, and understand, like the health minister has said that, you know, some of them come from .com families. I know, because I personally come from a family where my mother cannot even talk to me about condoms, not even about boyfriend, not even, I don't know. I feel like when she starts to open up, at some point we all become shy and no one can continue with the conversation. And I cannot blame her, yeah? So many of us come from such families, and you understand that different students in institutions of higher learning, where we understand the national policy on sexuality education in high school is very, very rigid, yeah? You cannot just go to, you know, secondary schools and talk about condoms. We hear PSC, we hear, you know, signing pregnancy cards and all that, yeah? So we want to understand, you as the ministry, what have you done on accessibility of sexual reproductive health services and comprehensive information? I add comprehensive because, you know, there is a lot of information out there. People have so much, especially in this digital era, there is so much information out there that sometimes is not even comprehensive, yeah? So you want to understand and get, you know, knowledge from you as the experts and decision makers of this country on how government has ensured sexual reproductive health services, their availability, but also accessibility to students in institutions of higher learning. Over to you.
Yes, thank you very much, Brendan. The question is how Ministry of Health specifically is ensuring that SRH services are available and that they're actually being utilized by students in universities. You talked about sexuality education, you talked about supplies and the like. I'll start by saying that Mbarara University of Science and Technologies is a very, being a student here, it's a privilege. Why? Because they have a regional referral hospital right next to them. So this regional referral hospital is under actually the control of Ministry of Health, unlike district hospitals. So each and every service that is provided in the regional referral hospital, including specialized services, is a direct contribution of the Ministry of Health towards improving the health of students in the university. We are well aware, and indeed we have a representative from the Adolescent and Young People's Clinic who will communicate to us the number of services that are offered in the clinic. We know that as university students, sometimes we have a lot of challenges. We have weekend marriages. Oh, I'm lying. I don't want to cut word. Weekend marriages. And out of that comes consequences, sometimes like STDs, STIs, unintended pregnancies, and the like. All this, we know as a ministry that mostly it comes about as a lack of information, as a result of lack of information, either to make the right choices, or sometimes the supplies might not be available. And as such, we are focusing mainly on providing you with information. We are finding you increasingly on online platforms, WhatsApp, TikTok, even TV, only that you no longer watch TV. But we are there. Twitter, there is lots of information coming your way on sexual reproductive health and rights. And please, if anytime you need to know anything, we also have a hotline, a Ministry of Health hotline, that you can always call and ask if you have any questions relating to sexual reproductive health. But still, if that's not enough, please find time and walk through the Adolescent and Young People's Clinic at the Regional Referral Hospital. You can get all the services that you need. We also train health workers to provide you with friendly services. Friendly services means that you can walk in anytime and access a service. Friendly services means that the health workers are friendly to you, that they give you services in private, and that they keep your information private and confidential, and that they also smile to you. So if you've noticed, most of our health workers at the regional referral, I want to believe that they are friendly. If they are not, please reach out to me, small. Then we can rectify that. Yeah, so thank you very much. That's one of the few things that we do to ensure service availability and uptake.
About weekend marriages, I hope people here are good. Please don't go and cook over the weekend. Read your books. You might go to cook and then you find another one has already cooked. So those things are not easy. Yeah, but we want to appreciate the ministry for doing such a very good job. They have told you about the Adolescent and Young People's Clinic. I don't know, but I think it's at the Regional Referral Center. So please visit the hospital. They have said that doctors and the health workers there smile. So you go expecting to get a free smile. In case you have issues with coursework marks, lectures and all that stress, you can go and pick the smile. Yeah, so please, we want to appreciate you, doctor. Please, let's clap for the Ministry of Health. Yeah, Ugandans take long to appreciate government, but once in a while, at least appreciate those small things that they are doing for you. Yeah, so doctor has talked about friendly, healthy workers, yeah? And for sure there is a challenge in universities in line with pinpointing students, criticizing them. Some students fear to be judged, yeah? Let me give an example. Universities have clinics, yeah? But I want to ask, how many of you use the university clinic on issues like sexually related? How many of you use the university clinic? We are doing a survey under OIF and we realize that most of the university students do not use the university clinics on such matters, but they can visit the clinic on issues like malaria and all that, yeah? And you would ask yourself, why is it like that? I think because young people have this fear that when I go to the university counselor to maybe talk about STDs or probably test for HIV or something like that, I'm going to be pinpointed at, yeah, or I'll be judged or I'll be criticized, yeah? And now, at that very particular point, I want to pick on someone from from someone that represents Mariestopes, Uganda. Yeah? We understand you guys give different services, and we've already said that some of those university students do not want to go and use our university clinics. Yeah. So in a scenario where a young person is not comfortable with the university doctors or counselors or healthy workers, and they want to visit you, Mariestopes, Uganda, yeah, we want to understand what kind of services do you give them, and where can they find you, and how effective are these services? You know, sometimes people are afraid. I heard someone saying that when you use these contraceptions, you do not give birth. So there is a lot of information out there, and some young people are not even sure on what particular method to use and all that. Yeah. So we want to appreciate you for making it here, and we know you're going to give us comprehensive information. Yeah. So what kind of services do you offer? How can these students come to Mariestopes? And as Mariestopes, are these services effective? Yeah. Over to you.
Thank you everyone for coming. My name is Fiona Vavidie, and I am the Social Behavior Change Communications Coordinator for the Western region. Before we even go or delve into this conversation, but the services are extremely effective. You never have to worry. But just to provide information about availability of services and where students can access them, in what models. As Mariestopes, we are an organization that targets people in different spheres. If we have people that would prefer to access the service on a private basis where you are paying money, we have a hospital in Kampala, but for Mbarara specifically, we have a health center, the Mariestopes Center. If you feel you can afford to pay, we offer the service there. Then we have outreaches, and in these outreaches we have where we work at different health centers within the town, within Mbarara city, but also within different trading centers in the city. If you see that tent and its appearance, it's because we are targeting young people at community level, where we realize that not everyone will be comfortable going to a health facility to seek a service, and sometimes, especially within the university premises and grounds, you find that people are very shy to express where their need is, especially when it comes to sexually reproductive health services in general. So we have outreaches where we work in different health centers all over Mbarara town, all over Mbarara city. So you go to Nyamtiobora, you go to Kamkuzi, you go everywhere. Even the regional referral hospital, we go as far as training and mentoring government health workers, because as our sustainability plan, we have to ensure that health workers at the different government health centers are able to offer the service and offer it effectively to anyone who needs it. So we have a channel or department that focuses on young people and focuses on health workers to make sure that they are able to offer services to young people and everyone else who comes in for services. We have a free hotline, like the Ministry of Health has. We have a hotline for which young people can call, and it is free of charge. You can call and ask any question. I'll be giving out cards, but it is 0800-220-300. Yeah, you can access services or information there. We are being very deliberate about providing information to young people. Yeah, and today we are very glad to be here because it means we get to interact with some of the peer project people, peer project mobilizers that usually work within the different hostels and residences that the students stay at, because that means that these are people that we can give more information to, provide even more information to their colleagues. Because if anything, young people are very shy, because out of the university numbers that are studying here, I doubt that this is the number that they have here, but still you have a smaller number coming. So you'll find in most circumstances, young people are not very free to come and speak their mind and speak what they really want. So for us as trained health workers, we know how to identify them and try to find ways of making sure we serve them in the best way possible. When it comes to lack of information and knowledge about sexual reproductive health services, whatever issues surround reproduction and young people getting pregnant and all those things, there are so many people that have very limited information. Yeah, what they know is stories that have been told, myths and misconceptions that have been said here and there, experiences that have been shared, and this is by people that have not exactly shared this information. So you find that where you would have had the chance to go to the health center so that a health worker gives you comprehensive information, young people are not seeking us out. But we are being deliberate about seeking them out. And we would like to do more in terms of even just providing information, doing activities like workshops, seminars, webinars, yeah, even using internet-based avenues to make sure we are providing as much information as possible, because while other things are concerned, the fact that students are not able to access services sometimes within the university premises, it is more important that they have information so that they can make informed decisions that impact their lives. Thank you so much.
You realize that this generation, especially looking at the current status quo, so many young people are busy enjoying TikTok, are busy enjoying Twitter conversations, the comment section and all that. That is the generation we are living in right now, yeah? And such important information they miss. I know this university has so many students, but how many of you have turned up today? But trust me, even those that have not turned up here, so many of them are suffering from things like STDs, mental health challenges, depression, and all that. Yeah? So please, I urge you young people to take some of this information serious and some of these opportunities. Yeah? Now, there are questions around HIV stigma, around PEP, around PrEP, around what tablet do I take when I've slept with someone who has HIV/AIDS, does it work, you know, and all those kinds of information and questions. Young people have them, yeah? Some of the young people are living with HIV/AIDS and are stigmatized, and you know, it's very, I don't know if we should call it unfortunate or actually fortunate that these days ARVs are around and you cannot really tell who is positive and who is negative. Yeah? And we are also living in a generation, as much as so many young people are taken by social media, we are also living in a generation where everyone says this gender, that gender, fear that gender. Banowayae, olimuyae, fear women, fear men. Yeah? You have your boyfriend has more 5 girlfriends. You have your girlfriend also has more 5 boyfriends. Yeah? So that is the generation we are living in right now. It is very funny. Yeah? So we have very many challenges of sexuality issues. Yeah? Sexual reproductive health challenges and questions around HIV and all that. Yeah? We are very lucky that we have TASO in the building today. Yeah? And you know, for TASO, I will actually not ask what services do you have at TASO. Yeah? I don't know how many of you have heard about Agenda 2030 or Vision 2030. How many of you have heard about ending HIV/AIDS by 2030? Raise up your hands, guys. Banana, you guys, please. You heard from your neighbor just now. Okay, Castor, you've heard. Yeah? But you know, so TASO has been, I don't know, you guys have been in place for so many years. We visited your headquarters as OIF and we've worked together on a couple of events, yeah? We want to understand, you as the AIDS support organization, yeah? Do you think, by the way guys, Someone asked a question that what do these guys mean by saying we are going to end HIV by 2030? Does that mean we are going to kill everyone who is currently living with HIV/AIDS and we only stay with negative people? Yeah. So young people have different questions, and we want to understand from you as the experts in this field. Talk to us about issues like PrEP. Talk to us about issues like PrEP. What do those things mean? What are they? Yeah. If someone finds out they're HIV positive, for example, out of the blue, like maybe today or tomorrow, any other day, what should they do? How can they overcome that? Yeah, there is stigma around that, and that is why so many young people do not want to talk about their HIV status. Yeah, because they fear to be stigmatized. Only brave people like MC Cats and all that we work with come out and, talk about their status. Yeah, but so many young people do not, come out and speak about them. Yeah, so for you, we do not want to tell us what services you have. We already know. Talk to us about the challenges that are existing in the current status quo. I don't know who should have the microphone first. And you guys, if you have questions around the things, you want to know, we don't know, but yesterday, maybe last night, you had sex with someone, or you passed somewhere, or you had issues, yeah? Please ask these guys while they are still here. Write your questions on those papers that we have given you, and feel free to ask your questions.
Participate in this. Yeah, in relation to what we are discussing, and HIV, I see most of the discussion is rotating about sexual and reproductive health, but HIV comes in at a long run. So for TASO, we have been in existence for quite a long time, specializing in the management of HIV and HIV-related conditions. But as time has gone on, we had noticed some good improvement. At one point, we had the new infections, or the prevalence at 5%, but of late it is at a rise, and which is the most worrying situation is that it is increasing more in the adolescents and the young persons, the young adults. When we talk of the young persons and young adults, we are looking at the age of 30 and less, 30 years and below, where I think most of us, we are still at campus in that age bracket. So that's why I appreciate so much the university to have this initiative, so that we can get reimbursed and educated about what is happening within our lives. So the most challenge that we are meeting as we go in this fight to end HIV and AIDS by 2030 is that most of us and most of the people are stigmatizing the services that target ending HIV. Not even getting stigmatized that you have HIV, but also those who are not known the statuses, they are finding services as obscene. For example, coming here to do a test, someone have already a negative attitude towards it, that creates more worry. So we continue to encourage each and everyone to take it upon his or himself to do an HIV testing as a starting point. To know your status is the starting point, and that's what TASO takes ahead as we fight against HIV, and as we fight to work together with the Ministry of Health, the implementing partners, like you said, who are the donors of these projects that aim at ending HIV/AIDS by 2030. So when we talk of ending HIV/AIDS by 2030, we may not necessarily mean that people living with HIV will all be eradicated on this world. We are looking at improving their health, improving their lifestyle, and ensuring they can also perform like any other person who lives with no HIV. That is the summary of the strategy to end HIV/AIDS by 2030. We want to see people living with HIV able to participate in economic activities, able to participate in development activities, students able to perform excellently even when they are living with HIV by that time. We want to end stigma. When you live with someone, or if your brother or sister or your parent is living with HIV, we want to see you take him to be a normal person, to be able to associate with others, not taking them to be special people who should not share with you at home, who should not receive same education, who should not sit with you. That's what we want to see ended by 2030. And this is being done in several ways. Very many interventions have been put in place, and they are all available for all of us to come and consume them. We have prevention services. The HIV prevention services are the first and foremost things everyone should know and take forward. When you come to TASO, we have counseling services. When I talk of counseling services, you will be informed about the importance of HIV testing. You will be informed about how HIV gets to you, or how you can live with it if at all you have it. Those are the counseling services. What you can do about having HIV infection. Then too, we have the testing services. After getting that knowledge, there is another component of testing. So you are tested, and on that day, you receive the results of the HIV test. Then from there, when you have tested, depending on the outcomes will determine the services that will follow. If we still find you HIV negative, we still follow the line of HIV prevention services, where we shall ask you to practice ABCD. I know most of us have heard about that. ABCD, where A, you abstain from sex, then B, you be faithful to your partner. If you are married, you be faithful to your wife. If you have a boyfriend, you be faithful to your boyfriend, to your girlfriend. Then C, if you can't abstain and you can't be faithful, there we encourage you to use a condom. At any one point you plan to have sex with a person that you don't know their HIV status. Then D, there we bring in a component of drugs, which are also preventive drugs. The moderator asked about PrEP and PrEP. So PrEP comes at point D. It's a drug which is designed to create a barrier for a person who is at high risk of catching HIV. Meaning that you take that medicine before you go in an act which is risky, which will put you at risk of getting HIV. I can put a case in point. We have people who are living with HIV, but they are in a marriage or in a relationship with a person who is HIV negative. That is a case in point I can give you. So in this case, a person who does not have HIV, who has tested HIV negative, is advised to take PrEP, which will create a barrier so that he can continue in his relationship but without contracting the HIV virus. That is PrEP. So you continuously take this medication until when you resolve the relationship. So if you are choosing to take that relationship permanently, then it means we shall continue supporting you to take the to take PrEP. Then PrEP, that is when, this is also a medication that we shall give to someone who has been involved or engaged in a risky activity that would have predisposed him to acquiring HIV, but within a period of 72 hours. If he can access a facility, a health facility, like TASO, like the regional referral hospital, any other health facility that is surrounding, that is in his surrounding, and within the period of 72 hours, that is 3 days, the health worker will go ahead to test and confirm if they are negative, HIV negative. And if at all the source is not known, for example, you had a sexual intercourse, unprotected sexual intercourse with a person that you didn't know their HIV status. That's what I'm meaning. The source is not known. So at that point, when we find you HIV negative, then we shall give you PrEP, which is a post-exposure prophylaxis for a period of 28 days, and we repeat the test, and after that we repeat another test after 6 months to confirm if you have been, if you are safe. That is PrEP. So on prevention services, basically that's what I can say. I've ended with D, which is drugs, basically to make sure people remain with a negative HIV serostatus. So on the other arm, if you have tested and we find that you have a positive HIV test, then person will continue to offer to you other more services which are in line with treatment and care. So we have those services, but it begins right from linking. You will be linked to a service provider who will be able to take you through another counseling session, which will initiate you to having ARVs. And why do we give ARVs? To improve the quality of the person living with HIV. Well, I will not go in how does that happen, but it is much of science. But when you take these medicines, then you will have quality life, and people will always do their activities like any other person who has no HIV in their body. That is what we do. And also in treatment and care services, we have got an element of elimination of mother to child transmission. Why do we have that? Because as we grow old, we are now in adolescent age, we are going to go in adult age, we leave school, and time is going to come when we have families. So TASO brings in that component to help all the young people, including adolescents, including the young adults who have been tested and found positive living with HIV, so that we can have a next generation which is HIV free. And in that way, we try to support this couple, make sure they take their medication through the pregnancy period. When the baby is born, also other interventions are put in place to support this baby, to ensure that this baby will breastfeed but will not contract HIV infection. And at the end of the day, we all fight together to end HIV/AIDS by 2030. Thank you so much. Back to you, the moderator.
You're going to need it at a future time. How many of you are married here and you're expecting to go with your husband to know whether you are, you know? So we want to appreciate you. There's a question that came in. I think we shall take questions later in a few minutes. And there are also more questions that I have here with me. And I'll ask them according to who is, you know, in that kind of, you know, line. But we want to take our last panelist. I don't want to leave any of my panelists, you know, unattended too. So we heard about the regional referral, you know, hospital, and they told us that at that side there is, you know, an adolescent and young people's clinic, and we are, glad and happy to have one of the representatives from the youth clinic at the regional referral hospital. I'll just give you a few minutes, about 3 or 2, to just let us know about some of the services that you have at the clinic and how.
I'm Shakira Namatov, representing the MRRH Adolescent Clinic, or the Adolescent Health Clinic and the Youth. Yeah, this adolescent clinic was launched last year in August. The Ministry of Health represented, and it was started in addressing a problem whereby you find these adolescents or the young people not being prioritized. In this I mean that these adolescents or the young people are not prioritized in a way that they are not taken as children and they're not taken as adults. So the services that they usually go seek for, they usually find challenges in there. So this adolescent clinic, in partnership with the Mbarara University, MRRH, Ministry of Health, here it was launched. And the services that it provides are services to do with the outpatient services, that is looking at when this adolescent or this young person comes in the adolescent clinic, he or she is assessed using the HEADS assessment tool, and that HEADS assessment tool assesses this adolescent in a way that this adolescent is asked about the home where she comes from or she comes from, talks about the peer groups that he or she interacts with. This adolescent is assessed, has the questions to do with sexuality, her sexual life or his sexual life, the depression. And yes, the adolescent clinic has a full-time clinic officer. It has the social workers, and these people are doing a good job. They do counseling. We are in partnership, we collaborate with the Department of Pediatrics. We collaborate also with the Department of Psychiatry, that gives us a professional counselor that is always there. We also have people from the HIV clinic and also people from the family planning department. And these people are fully there to provide services to these adolescents. We also have the research and the community engagement part, whereby we have the community advisory board, which we engage, and these are people from the religious department, Ministry of Health, Ministry of Gender, people to do with the local council, and we also have these young adolescents also on the board. We also have parents on the board, and these parents help us, all these people help us to know, are we doing the right thing? Are we giving? Because looking at an adolescent, if, for example, I would pose a question to the Mariestopes people. If a 14-year appeared to the clinic or to your space wanting to access family planning, would you provide the service to this adolescent? So those are the things that we usually work with around the community advisory board. These people help us get to know, are we doing the right thing with these adolescents? And we also have the research people that we are working with different organizations that these people have supported, first of all, in the establishment, because we couldn't do this in, it will need money to run, and also the Ministry of Health, which has played a big role in this, with the materials that these adolescents need to read, and with all the information that we give these adolescents, we usually get from the Ministry of Health. Over to you, the moderator. Thank you.
Okay, thank you so much. I'm going to give you panelists only 2 seconds. Only 2 seconds. I don't know how you're going to use that 2 seconds, but you have only 2 seconds to respond to some of these questions. This one was asked about circumcision. That do you guys work about circumcision? And if yes, where? Does any person? Okay.
Yes, The answer is yes. We offer safe male circumcision, and it is within reach almost in all facilities. I can say government facilities. Why? These facilities are being supported by TASO, and TASO is implementing the HIV prevention services. So it doesn't matter where you have come from, whether you are in Mushenyi, whether you're in Uganda district, whether you're in Mbarara. If you see a government facility, you will find it, including TASO itself, which is within reach from the university in the TASO village. We also offer safe male circumcision from Monday to Friday at no cost.
Okay.
Thank you.
So I think explain to us the most effective method of HIV control and pregnancy.
Thank you for that question. With regard to HIV prevention and all, my fellow panelists had explained that the ABCD, yeah, you abstain, or be faithful to your partner, use a condom, or use the drugs that are available to make sure you either prevent, or if you're exposed already, then you wouldn't have to worry too much because PEP is there. And when it comes to pregnancy prevention, it's a bit broad because everyone in their category would approach it in a different way. As university students, the expectation is that you should abstain, so you avoid getting pregnant.
And these ones are abstaining, so then we're talking about the rest
as well. Absolutely. But if you're not abstaining, yeah, then there are several family planning methods. Unfortunately, I can't offer all the information regarding family planning methods on this panel right now, but we have a tent where you can come and we explain to you. There are different methods, short term, yeah, in terms of within the time that you'll be having a partner, where someone will be having sexual intercourse on a daily, but also there is long term as well. And the safest way for a university student, because the sex is not so regular, I would say is condoms, yeah, because you are preventing STDs and other sexually transmitted diseases and HIV plus pregnancy. And since for the biggest part of the time, research has shown that for young people, sex is not regular, like how married people will be, where on a daily they expect that they're going to have sex. So since it is not as regular, condoms would do. But if you think it is more regular, then we have different methods. If you want to
Some are saying to them it's regular.
If it is regular, then we'd advise you to use a long-term method, which we can offer you today. Yeah.
Okay.
If you want a short term, there are pills, there are injectables, there's all sorts of things. We can give you the information so that you know, because the biggest challenge young people have today is they don't have information. So you are a university student, but you can very well lack the basic information to protect you from STDs and pregnancy that you don't want.
Okay, thank you so much.
And consistent use. You can't go one round and then the second round you forget. Yeah? So it
some get tired.
It is, you can't, so you have to have constant supply, but absolute condoms is one of the safest. It's actually one of those that you can take and cover you 100% if consistently and correctly used. So it is important. And also there's lots of myths and misconceptions around that as well. Some people will wash them, some people will do all kinds of things. Yes, absolutely. Information.
Wash the condom after using it and use it again.
Okay. There are certain incidences where people are not aware of how to use them. So the most important
Please don't wash them.
Yes, we can provide you with the condoms. And I'm glad I met Mr. Sam Arinda here, because we can always find ways of replenishing whatever dispensers they have. And I'm sure even the adolescent clinic would be willing to oblige to provide condoms on a continuous basis. And I hope there are dispensers within the university in places that are private. Because the thing with young people is that they will want to use the method, they would want to use the condoms, but they don't want to be seen picking the
These
condom.
guys are not shy.
Yeah?
They take
Yes, but we are willing to support that as well to make
Okay.
sure that they are replenished in whatever corners they pick them from, so that there is consistent and correct use.
Okay, thank you.
Hello, students. We're talking about condoms. Correct and consistent use. You might put it on and then have oral sex. That is not consistent and correct use. Yeah? But also, most importantly, and this is why we are emphasizing abstinence, condoms won't protect you against certain STIs, like hepatitis, like warts, like herpes. Okay? So you need to lead a responsible sex life.
Those ones are abstaining. This information they're going to take to their neighbors. Someone is asking, I heard about the injection for HIV. Is it true? Please, pass the mic.
Much for that question. The HIV injection drug, it is true, but it is for prevention, HIV prevention. It's not for HIV treatment. It is a single drug in the injection form. And when it comes to the HIV management, we use 3 drugs. And that means this injection will only be used for HIV prevention services, but not for HIV management and treatment.
Oh, I think this person was right. You know how people take ARVs? So I think their question was in line with that. Is it true that besides ARVs, someone can just instead take an injection?
It is not true that you can, besides HIV, ARVs, you take the injection. The injection is only for HIV prevention, but not HIV treatment, meaning that people living with HIV are not advised to take this injection. I think that is the answer you need.
Okay, thank you so much. I have my friend who was born with HIV, and now she has a partner who is negative. But in their relationship, they both tested for HIV, and they found out that they're all negative. How possible is it that someone who was once positive came out with negative results? I think this one I can also answer. When you take ARVs for a long time, you can guide. But I think when you're on your medication and you take it very well, time comes and they can no longer detect the virus, isn't it? You're undetectable. Your viral rate is. Please continue from there.
Yeah, some situations happen, but there are many conditions that determine the test outcomes. Number 1 is the competence of the person testing. Number 2 is the quality of the kit that they are using. Then number 3 is somebody's body, your body. So if I considered the other conditions to be perfect, if a person living with HIV is initiated on treatment, that is ARVs, we expect viral suppression, and at the end of the day, when you do a PCR test, an antibody, the DNA test for HIV, the machine can tell you that the viral load is not detected. So at that point, the body is not going to continue producing antibodies against the HIV infection. So when you go to the clinic where they are going to take your blood and test your HIV, they are testing for the body's response towards the HIV infection or the virus in your blood. And in a situation when the viral load has been suppressed, and the body is not producing more antibodies against the virus, the HIV virus, you can certainly get a negative test. It can happen, but that doesn't mean that you have no HIV infection. Okay? And for the other person who is in a relationship and also is testing negative, yet they are engaging sexually, unprotected sex, is being protected because the partner is taking her medication well, so the chances of transmitting HIV infection to the partner are also very low. There is a slogan that we have that undetectable, then untransmissible.
Okay.
We say U is equal to U. You will see it somewhere where it means that if you have undetectable levels of the virus in your blood, you will not transmit.
Okay.
The one which is widely known is what we call the conventional method, where you will be circumcised and they put threads in your skin. But there are more methods that are coming on board, and the most recent one is shangling. So you can go on YouTube, you can go on Google and find out about shangling. The way I'm saying it, that's how you spell it. Shangling, it's another method that we are using to circumcise. It is very convenient and it is available, readily available at Tasso.
Is it from China?
The inventor is the Chinese.
Oh, yeah. Okay.
As you know, Chinese are very creative and innovative. So we have gotten that as another service. So I would encourage that most of the students who are not yet circumcised, please come in. We shall offer to you this service. We have it at Tasso, here in the Tasso village, and you'll be able to continue with your education with no interactions.
Okay, so I think you've all heard. If you're not in team, we also have people online, by the way. It's a digital era. You might think you're here alone, and we want to appreciate you guys for being with us from the start up to where we are now. In fact, I think I will pick up at least a question from the online team so that they do not say there is no inclusivity and all that. Yeah. So someone from the online team, Elizabeth Kemigisha, asked that are these services of PrEP and PEP open to all our students who can work in the Tasso offices? Usually there is a debate on whether PrEP and PEP are free or something like that.
Yes. Usually there is a screening process that will take place. Like I said, PEP, if you come within 72 hours, that is the beginning question.
So the answer is yes.
The
services are available. Thank you for giving us information. Thank you so much for coming through. Thank you so much for bringing the services to Mbarara University. A big hand clap to Ministry of Health for organizing this. And a big hand clap to the University Guild leadership for mobilizing students and organizing this. We are very humbled. Thank you so much. We are really humbled.